want to say good morning to you, ma'am.
Good morning.
My name is Annie Lewis. I'm a nursing student from Columbus State University, and I'm going to do a head-to-toe assessment on you today.
Okay.
And thank you so much. And if you wouldn't mind, if you would have a seat on the examining table, thank you.
Okay.
I've already washed my hands, but I'm just going to wash my hands again. Okay. Just going to sanitize them this time. Okay. What I want to do right now, we've already done your vital signs and your blood pressure in your right arm was 150/91, and your blood pressure in your left arm was 150/88, and your heart rate was 80. Your respirations, they were 20. And I want to now just assess your skin.
Okay.
Gonna look at your skin, okay?
Okay.
Skin is somewhat dry. No lesions or abrasions noted. Gonna check your skin turgor. Good skin turgor. Okay. Gonna check the temperature of your skin. Warm to touch. Within normal limits. And now I want to do your height and your weight, if you don't mind, okay? If you would step on this scale here. The weight is 200.6. Very good, okay. Step down. And I want to do your height. If you would stand against this wall. Height is 57 inches. Okay? Now while you're standing, I would like to have you walk down this way so I can just check to see how you're walking.
Okay.
Okay? Okay. Gaits within normal limits. No swaying or any limps noted. Okay? I also want to check the curvature of your spine, so if you could just bend forward for me. Okay? No abnormal curvature noted, no scoliosis. Thank you. Okay, I'm just going to feel your joints. Any pain or tenderness?
No.
Okay. If you have a seat for me, thank you. Now I'm going to check your scalp, okay, and your hair. No lumps noted. Hair with a little receding line. Braids intact. Okay, so I'm also going to look at your face symmetry. No abnormal symmetry noted in the face. I'm going to also, I'm gonna check your eyes, okay?
Okay.
Okay, I'm going to put on my gloves because I'm going to check your eyes, your mouth, and your throat. Okay. Okay, your sclera is clear, and I'm also going to look at your conjunctiva. It's pink. Okay, and I'm also going to check your corneal reflex. So if you would look directly at me. Look directly at me. Open your eyes wide. Thank you. You'll feel a little something. Corneal reflex intact. I'm going to check your nose. No asymmetry noted. Gonna palpate your sinuses, your frontal sinuses. Going to palpate your maxillary sinuses. I'm going to look at the turbulence in your nose. No swelling or polyp noted. No deviation of the septum. If you would open your mouth for me, I'm going to check your palate. Say ah. Lick it way out your tongue, please. Thank you. Way out. Ah. The uvula is midline. Hard palate without any abrasions. Soft palate intact. Uvula moves up. I'm going to check your dentation. No cavities, but we have a couple of teeth missing in the lower front. I'm going to check her ears. I'm looking at the auricular, the lobes, okay? Looking for drainage. I'm going to check her top part of her ear with her eyes. They are in line. I'm going to remove my gloves. I'm going to check your trachea. I'm going to palpate your neck. Trachea is midline. I'm also going to check your thyroid. You tilt your head just back a little bit. Would you swallow for me? Okay. I'm going to step around behind so I can feel your thyroid from behind, and I also will locate the isthmus. thyroid palpated, no lumps or nodules noted. Isthmus is located right in between the lobes of the thyroid. No lumps noted. I'm going to also check my capillary refills. Patient has on nail polish, so I will check her fingers. Capillary refills within 2 seconds. Okay. I'm going to check now for the alum test, and I'm going to check for the Tenille test and the Felin's test. The alum test, I'm going to ask you to turn your hands over and squeeze them tight, make a fist. One hand would be fine. Thank you. Hold it down a little bit for me. Okay, I'm going to compress both nerve, ulnar and radial. Hold it tight. Open your hand, please. Release the ulnar. Good blood circulation. Okay, release the radial. I'm going to ask you to do it again, please. Tighten your hand. I'm going to check the radial nerve as well. Hold it down, please. Occlude both nerves. Release. Release my ulnar, my radial. Good circulation. Hands are pink. Now I'm going to ask you if you would open your hand, and I'm just going to tap at the wrist area where we have the tent of the carpal tunnel. Any pain or tenderness?
No.
No pain or tenderness?
No.
Okay. So I'm going to ask you if you would take your thumb. Now I'm asking you to abduct your thumb, push it out. I'm going to push. Any pain or tenderness?
No.
Okay, I did the Tenille test. Now I'm going to ask you to take both of your hands and bring them together like this and push hard on them. Push very hard. Any pain or tenderness in your wrist?
No.
Okay, that was the Felin's test. Thank you very much. Now, what we're going to do, we're going to go on and check your, we're going to go on and check for your lymph nodes. So, I'll be palpating your face. I'm going to check your lymph nodes, your face, your neck. I'm going to do, this is your preauricular, your postauricular, your occipital, your tonsils, submandible, submental, superior. Then I'm going to do the anterior deep cervical chain. I'm palpating the posterior deep cervical chain. I'm doing the cervical chain. No tenderness, no lymph node noted. Now I'm going to go on and do your, while we're here, I'm going to do your eyes. We are just going to go on and do our visual test. I want to check your feels, your olfactory, your cranial nerves, all of them. So first we're going to do your smell, and then we'll do your eyes. Okay. And we'll do all of the visual, the 12 cranial nerves. We have our olfactory. What odor?
Like Senate odor.
Okay. Good. Cinnamon. Right, and I'm going to check your visual right now with my pen light. Well, I'll use this one. And I'm going to darken the light just a minute. Okay? If you look directly at me, close your eyes, open them, close your eyes, open them. Okay? I see that pupils constrict, direct, and consensual. I'm going to ask you to follow this. Converge and accommodate. I'm going to ask you if you would follow this light. I'm going to check your cranial nerve 3, which is oculomotor, 4, which is trochlear, and 6, which is the abducent. If you would follow with your eyes. Cranial nerve 1, 3, 4, and 6 intact. And while we're doing it with the light out, I'm going to check her sinuses. Okay. I'm going to turn the light back on. Then I'll have you vision checked. Okay, I'm going to ask you, if you don't mind, if you would take a stand 20 feet away from this chart. And if you would have a card over there, you would pick that card up, and we're going to check both. Thank you. You turn this way. We're going to do your right eye, which is OD. We're going to ask you to cover your right eye right now. I would like for you to tell me if you can read, what line you can read. Is it 1, 2, 3?
1, 2, 3, 3. I have a problem.
3. What about 2?
I see FL.
Okay. The right eye. Okay. And would you cover your left eye, please? And tell me which one you can read. 1, 2, 3, 4.
2.
2. Okay. And would you put the card down, please? Did you tell me what you can read? 1, 2, or 3?
3. I can see. Is that YOZ? TOZ?
Okay. Well, thank you very much. If you would have a seat back here. Your right vision is 20, 100. Your left vision is 20, 100. And bilaterally, your vision is 270. So your cranial nerve 2 have been checked. Okay? And I'm going to go on while we're here. I'm gonna check your cranial nerve 5,
Okay.
okay, and 7. Cranial nerve 5 is your trigeminal, and then 7 is gonna be your facial nerve. So I'm gonna just also gonna check your sensory. So if you would close your eyes and tell me when you feel it.
Okay. Okay.
Okay,
Okay.
okay. Cranial nerve 7 is intact, and your cranial nerve 8 is going to be your acoustic nerve. And if you would just listen. Cranial nerve is intact. She was able to hear the soft whisper. I'm going to check your cranial nerve number 9. Okay? And if you would frown your face up, show your teeth. Okay? And if you would speak to me.
Hello.
Okay? Cranial nerve 9 is intact. And if you would stick your tongue out, move it side to side, put your tongue back in, push it against your cheek, and I'm going to press against it. Good strength, other side. Good strength. Okay? So I'm also going to check your cranial nerve number 11. Okay? I'm going to put my hand on your shoulders. Would you shrug your shoulders against my hand? Okay. Very good. Good strength. Now I'm going to ask you to swallow. Okay. All right. So I checked all the cranial nerves, and hypoglossal, she was able to move her tongue. Okay. And cranial nerve 10 was the vagus nerve, and I checked all of those. I'm going to now check for a sensation. If you would close your eye, tell me what you feel.
Pain-free.
Okay.
Pain-free.
Okay, good sensation. Okay. I want to, I'm going to put an object in your hand, and I would like for you to tell me what that object is. If you open your hand, this is sterogenesis. Sterogenesis. Close it. Tell me what you have.
Safety pin.
That's correct. Now I'm going to do the graphothesis, and that's going to let me know if your sensation is good and your cerebellum is good. If you let me have your hand. What did I draw in your hand?
3.
Correct. All right. Now, I'm going to do your pulses. I'm going to check your pulses, okay? I'm going to check the carotid pulse and going all the way down. I'm going to start at trachea. I'm going to move over. I'm going to palpate the carotid one at a time to prevent any syncope episode. Carotid's palpable at 2 plus. Okay? Hold your arms out. I'm assessing the brachial artery. 2 plus bilaterally. The radial artery, 2 plus bilaterally. I'm going to check my popliteal. One plus bilaterally. My posterior tibia, 1 plus bilaterally. My dorsalis pedis on the right is 2 plus. On the left is 1 plus. If you would just lay down for me now, and thank you. Right now I'm going to check your femoral artery. Okay. Both femoral artery 2 plus bilaterally. And while you're down, I'm going to go in and check your lungs sound, and your heart, and your abdomen. I'm going to check her lung sound with the diaphragm of my stethoscope. I'm starting at the top, at the apex of my lungs. I'm going across. I'm going down. I'm assessing the upper lobes, going down on the right, assessing my middle lobe on the left, my upper lobe, down and across, my middle lobe on the right, across, my lower lobe on the left, around, my lower lobe on the left, on the right, my middle lobe, on my right, my lateral side, my lower lobe, on the left, my lower lobe. And I will have my patient, I'm going to check now her excursion. So I'm going to use my hands to check her excursion. If you don't mind, if you would take a deep breath for me. Breathe out. Good excursion. I'm going to check for consolidation, anterior first. I'm going to ask her if she would repeat 99, and we're going to use all the sites I did for auscultation. Would you repeat?
99, 99, 99, 99, 99, 99.
Thank you. All lobes anteriorly is clear, no adventitious sound noted, no good excursion, and no tactile fremitus noted anteriorly. While she's still lying, I'm going to go on and check her heart sounds anteriorly. First, I'm going to check it. I'm going to my second intercostal mid-sternum border on the right. It's going to be my aortic area. left, I'm going second intercostal, left sternum border,